to Catholic Answers Live, the program where you participate with your questions about apologetics and evangelization, including the most important theological, spiritual, moral, and social issues facing the world today. Call now with your question for today's guest. Toll free 1-888-31-TRUTH. That's 888-318-7884. Now, from San Diego, Catholic Answers Live.
Welcome back to Catholic Answers Live. It's Monday. Happy Year of Faith. Happy Advent to one and all. This is a part 2 of our Q&A open forum for the pro-choice folk only. 888-31-TRUTH is the toll-free number. As promised, one of our favorite guests is back. Her name is Stephanie Gray. Stephanie is the co-founder and the executive director of the Canadian Centre for Bioethical Reform. She has debated in numerous venues, college campuses. She's appeared on VTV, the ATV News, Global News, CTV Television, the Miracle Channel's Insight. She's been interviewed on Fox Channel, NBC, ABC. She holds a bachelor's degree in political science from the University of British Columbia and a certification with distinction in healthcare ethics from the National Catholic Bioethics Center in Philadelphia. She joins us now from Vancouver, British Columbia. Stephanie, welcome back.
Thanks, Patrick. It's always great to be on your show.
We are big fans of your Archbishop, J. Michael Miller. Just want to let you know that.
Oh, he is a very holy man. This is a fantastic archdiocese here.
And it's kind of your home pad. Normally you're Calgary, correct?
Normally I'm Calgary, and I'm actually on my way to move to Toronto, but I'm home in Vancouver for a bit and loving it.
And thank you for pronouncing it Vancouver. It means a lot.
What do other people say?
Oh, well, down here it's Vancouver, like Hoover. As opposed to that soft little U. So I feel at home. It's like Torontonians don't pronounce the second T, right? Toronto.
Right, yes.
Well, you're a great advocate for life,
from.
and well, it's always I always wish you were on for more than an hour, as I do most of our guests. But there's a lot to cover, and I hope in the next hour we'll speak of that the case of the woman in Ireland who died. There's a lot of information the public doesn't know about, and perhaps the right question will trigger an in-depth discussion on that. But I want to honor the folks who've been waiting patiently through the first hour. Want to go straight to caller, Stephanie?
Great, I'd love to.
All right, let's go to Bob in Eastern Missouri on KHJM 89.1 FM. Hello, Bob. You're on the air with Stephanie Gray.
Very good. Coming in good?
Yes, indeed. Welcome.
Okay.
Yes.
Well, this should be an excellent segue. I'm going to stick with what we discussed with the screener in that.
Okay.
And help me work it into a question if you have to. The idea that poor and destitute people should get abortions, and then of course that involves government funding, things like that. The young lady you're with is in bioethics.
Yes.
Another item that concerns me is genetically modified babies, which is really scary to me. Actually, I'm what you call a swing voter. I was pro-choice, but now I'm pro-life.
Well, Bob, you just outed yourself as someone who's pro-life. This is pro-choice only. You're going to cause a lot of heads to roll here for getting through the system.
Did I say it backwards? I'm sorry.
Oh, you're former pro-life, but now you're pro-choice?
No. I was pro-choice. Now I'm pro-life.
I see. So you're an agent from the light side.
Yeah, I guess I'm what you call a swing voter. And by the way, I'm also abstinent.
Okay, well, that's a little extra layer of information there, Bob. I'm still waiting for a question for Stephanie, though.
Yeah.
The idea that government funding to allow poor and destitute people to get free abortions, and on the other end, what do you think about genetically modified babies? Since you're into bioethics, the idea of genetically modified babies scares me a lot.
I'm a little nervous here, Bob. What's a genetically modified baby?
Modifying the embryo.
So it becomes what, or can do what?
Picking what you want: eye color, hair color.
Right.
Stephanie, you have enough of a hook here?
Sure. Well, Bob, maybe I'll start with the first point that you raised about the poor having access to government-funded abortions. Are you saying that you think the government should pay for poor people to have abortions?
No, because I think that makes us very like the Chinese in their mandatory program.
Okay, but just Bob, I want to get, since I'm technically supposed to move on because you're actually not pro-choice. Genetically modified babies. I don't know how well designed babies can be, Stephanie, at this point in time.
I mean, tragically, you can select, you can be making manipulations to human beings, and I would obviously agree then with Bob the caller that this is something to be concerned about, because fundamentally at the heart of the pro-life message is that human beings are subjects, not objects. We are not the kind of thing to be used and abused and thrown out when we get in the way and manipulated to be what someone else wants us to be. So to truly respect the dignity of the person is to embrace and welcome them as they come to be, not make them as we want them to be. And so that would be the problem with any kind of genetic modifications that could be made is we are distorting who they should be because, oh, well, I want my child to have blonde hair or blue eyes and all of that. So, you know, there's a problem with that and a problem also with, you know, as you've raised about giving the poor access to abortion, because it's not about having a right to something that is wrong. We don't have a right to something which is wrong. And so because abortion fundamentally deprives humans of their right to life, we don't facilitate that whether someone is poor or rich.
Bob the caller, as Stephanie called you in eastern Missouri, glad to have you call, but we do want to limit the balance of the show to pro-choice folk only. We don't want to hear from pro-lifers, but we're glad you're out there, Bob. Glad you switched sides. It's 8 after the hour. We'll go, you know, the next question, I think we'll make sure we have a good second segment with Stephanie Gray, and I'll punt a little bit, take a slightly early break and get back. And Quentin in St. Louis, you're up next on Catholic Answers Live, followed by Billy in Dallas, Tony in California, Chase in Bakersfield, California. Lots more to come with the co-founder and executive director of the Canadian Centre for Bioethical Reform. Do check out their fine website, unmaskingchoice.ca, especially if you like to talk about the abortion issue, but you've never actually been exposed to what an abortion is and what it does to the baby. Not for the faint of heart, but an excellent resource for visual and scientific proof of the status, anthropological and human, of the preborn human being. Unmaskingchoice.ca is the website. Stephanie Gray is the executive director of the Canadian Centre for Bioethical Reform. I'm Patrick Coffin. The number is toll-free, 888-31-TRUTH. Catholic Answers Live returns after these words. Touching that dial is strictly prohibited.
Grab that open phone line and get on board. Catholic Answers Live.
Even so, when you see all these things, you know that it is near, right at the door. I tell you the truth. This generation will certainly not pass away until all these things have happened.
Jesus spoke of his return and the end of the age during the Olivet Discourse in the Gospel of Matthew. But what exactly did these words mean? It seems as though various groups throughout history have been predicting the end of the world for centuries, from as long ago in history as the Mayan civilizations to as recently as Harold Camping just last year. With all the confusion, who's to know what is right? Author David Curry helps to cut through all the confusion in his new book, What Jesus Really Said About the End of the World. Curry examines Christ's end-time prophecies using the tools of biblical scholarship, the wisdom of the Church Fathers, and Old Testament history and typology. He unlocks for you the most important message behind Jesus' prophecies and warnings, which is not to inspire fearful predictions, but to remind us that our own end will surely come, so we must always be ready. Know the facts. Order David Curry's new book, What Jesus Really Said About the End of the World. It's included in our annual Christmas sale at a very special price. Call 888-291-8000 or log on to Catholic.com.
St. Augustine is one of the Church's most beloved saints, and for the first time, you can bring his story to life in your community. Ignatius Press presents Restless Heart, the first feature-length motion picture on his life. Churches and other organizations are experiencing standing room-only crowds for the film, suggesting that it can be an extremely effective tool for evangelization as the year of faith unfolds. Be a leader in evangelization by organizing a theatrical event. Visit RestlessHeartFilm.com to learn more.
Call now with your question. 888-318-7884. This is Catholic Answers Live.
Welcome back to the show. Q&A open forum for pro-choice folk only. If you believe that abortion is a woman's right to choose, and that's about it. If you think that there should not be laws protecting nascent human life before the moment of birth, we want to hear from you, Catholic or not. 888-31-TRUTH, that is the toll-free number. Our guest, Stephanie Gray, now goes by the magic of Marconi and Edison to St. Louis, Missouri, to Quentin on 89.9 FM, KHJM Radio. Quentin, welcome to Catholic Answers Live. You're on the air.
Thank you for having me. This is kind of a two-part question. Early in the segment, and I pray that this is not a repeat question, but early in the segment, someone asked a question in reference to someone being raped. And you gave the scenario of if a person was raped, the wife was raped, and the husband wanted to have the abortion but wasn't sure whether it was his or the rapist.
Right.
Well, are you for abortion, against abortion for any situation or reason? And should a person have the choice or right to abort because of a certain situation? And
right.
referencing, yes.
I'm not sure if Stephanie was able to hear the first part of the show where that question was raised, but I think you can, straight up, I think you get the question.
I do, yes. And in terms of asking, am I against all abortion in all circumstances, we have to ask the question, what is abortion? So, Quentin, let me ask you, how would you define abortion?
Okay, well, early in the segment, we were talking about, you made the statement that it's a life at conception.
No,
so,
Quentin, she's asking a different question, Quentin.
So
what is an abortion?
What is an abortion? To get rid of, terminate.
Through what means?
I'm not sure which,
Well, do you know what abortion is? Have you ever seen one? What does it do? Yeah.
It's terminating a life. I'm assuming that's what you're saying. Terminating the birth of a child or...
Well, Quentin, I could smother you or decapitate you or arrange a concrete truck accident, or you could die of a disease. But this is sort of a factual question. I really don't mean to put you on the spot, because most people use the word abortion and they don't really know what it is. They've never seen one. They don't know the various kinds of abortion procedures and what they do to the baby. So that's really the heart of Stephanie's question. Do you know what an abortion is?
Okay. So, well, explain to me what is an abortion, so that I'll have a clear understanding.
Very good. Now we have good. We've got forward motion now, Stephanie.
Okay, so if you look at how the medical literature defines abortion procedures, a majority of abortions are done in the first trimester of pregnancy, where primarily a suction abortion is done, which is where a powerful suction tube is inserted into the uterus and turned on, and the power of it literally sucks the baby's body parts out piece by piece. There's also a D and E abortion, where the parts are pulled out piece by piece with medical instruments. So when you ask me, would I ever accept situations where abortion would be permissible, what you're really asking me is, would I ever accept a situation to say it is permissible to pull a baby's body parts off piece by piece? And so because I respect human life, I'd have to say no, it is never appropriate to dismember, decapitate, and disembowel the body of the youngest of the human family. What would you say?
Okay, I understand where you're coming from, but
what would you, Quentin?
Yes.
Stephanie asked you a fairly plain, straight-up question. What would your answer be?
Would I? No, I wouldn't want to. But the thing is that this has been turned around on me. You previously stated that from the point of conception that it was a human life.
Yes.
So at conception, are you pulling out human pieces, piece by piece?
Well,
or is it an actual human?
Well, Quentin,
at that point?
A few moments after conception, we're talking about at the subcellular level, a very small person, very small indeed. But quite quickly, that little person grows, and we change the name: blastocyst, zygote, embryo, fetus, infant, teenager, adult, old person.
Okay.
I think
Stephanie, go ahead.
Another point, Quentin, would be that when we're talking about surgical abortions, even the first trimester, we're talking about what I described. Can a chemical abortion happen even earlier? For example, some methods of the birth control pill, which can prevent implantation. Can that happen early in pregnancy? Yes, but even that is destructive of the life because it essentially starves the child. By preventing the child from implanting in the uterus, it prevents the child from getting the nourishment she needs to sustain her life. So you're then asking me, is it ever okay to starve a child, to deprive them of the things that they need to live? Do you think it's ever okay to do that?
A child that's out of the womb, no. A child that has...
Why not?
Okay,
why not?
Wait, hold on. But you're trying to... you made the statement in reference to a child at conception. So if my mother was raped and she went to the doctor and they gave her a pill to kill whatever it was, whether it was at conception or not, she's not sure whether she's pregnant or not. And just so happens that she was. So if you gave me a pill and you said that you're against that type of abortion, then I don't think a person is wrong for aborting.
Quentin, maybe consider this. Is it justifiable to deprive a very tiny person of the nourishment they need to live because their father committed a crime?
No. Let me ask you this question.
Well, let's Quentin. No. Stephanie.
Okay,
you know what? You start.
If I could,
Quentin, hold on a sec. Stephanie you're creating an argument. Stephanie's creating an argument, Quentin, and it's leading to a conclusion. So we're inviting you to go there to the conclusion. Stephanie, go ahead.
So if you agree with me that we can't, it's not ethical to deprive a tiny person of the nourishment they need to live because of a crime their father committed, then even this understandably horrific scenario you describe of a woman being raped, if a drug administered to her would deprive a tiny human of their ability to continue to grow and develop, then that would be giving that tiny human the death sentence because of a crime that human's father committed. And you just told me you wouldn't do that you think that's wrong.
Quentin.
Well, I said that. Well, if a person has a choice to commit to have an abortion because they were about to die, and by them being pregnant would cause them and the baby to die, do you not think that is right for a person to have an abortion then?
Well, in that situation, we can't kill one human to save another, right? Like if I said to you, for example, if someone needed a heart transplant, would it be ethical of me to go kidnap someone and have surgeons steal their heart in order to give it to someone who needed a heart transplant? And that person
we're not talking about it. We're not talking about that. We're talking about being pregnant.
But if you'll bear with me,
Quentin, that's why it's called Quentin. It's called an analogy. There are some dissimilar things and some similar things.
So there's a reason for this, and I realize it's not clear yet, but if you'll bear with me, I have a purpose for this analogy. Would you agree with me that it wouldn't be ethical to steal a person's heart to save a person who needs a heart?
I agree.
Would you agree with me on that? Okay.
Yes.
So what it sounds like you and I agree on is that we cannot do evil, steal a heart, in order to bring about what is a good thing, save someone with a heart problem. So all I would say is we then apply that principle that you and I agree on to the circumstance of the woman's life being in danger. I can't kill an innocent child in order to save someone else, the mother, in the way I can't kill a person who has a heart in order to save someone who needs a heart. But
so you would allow both of them
Hold on a second, Quentin.
Well,
let Stephanie finish.
You raise a good question, Quentin, and the important point I'm about to make is saying that you may not kill an innocent child to spare the woman's life does not mean that you're left helpless, does not mean that both are going to die. Because the reality is when a woman's life is in danger, it is ethical to intervene on whatever the medical condition is and do our best to address the medical condition and, where possible, save both lives. Now, we may not always be able to save the baby's life if we lack the technology required to sustain the child's life, but that's not the same thing as an abortion. So, for example, if I have what's called an ectopic pregnancy, where my baby is growing in my fallopian tube and the tube in expansion could burst, it is ethical to address that medical condition of an expanding fallopian tube, because if we don't address it, the tube bursts and the baby dies and I can die. So the procedure called a salpingectomy, where that section of the tube is removed, is an act on my body, the fallopian tube. And in that act, it's a good action because if left alone, I'm leaving this pathological condition to result in the death of my child and myself. So I have to remove that tube. Then if I could transplant the baby somewhere, I would. We lack the technology right now, so the child dies as an effect of addressing this pathological condition within my body. So how is that different from abortion? Abortion doesn't target the woman's body, it targets the baby's body. It's not trying to address a pathological condition, it's trying to dismember a separate life. So do you see the difference there, Quentin?
But in the end, is it not still, is the baby still in that part of the, that was taken removed?
Sorry, is the baby in the part that they remove?
Yes.
Yes, because the baby is basically lodged there.
Technically, no matter how you look at it, the baby was aborted. No matter how you look at it, technically, the baby was
Quentin,
aborted.
We're talking about direct versus indirect.
But regardless of how it's done, technically...
Yeah, hold on a second.
Okay, Quentin, let me put this to you, because you raise an interesting point. If the end result is the same, which it looks like, does it make the means equal in two different scenarios? And it doesn't. And here's an analogy to understand that. Let's say, Quentin, two people are drowning, and you swim out into the ocean to try to save them. As you sweep your arm out to grab the two people, you only have the ability to grab one, and the other person ends up going below the surface and drowning. Now, are you responsible for killing the other person you didn't have the capacity to grab? Quentin?
But that scenario does not relate.
Just bear with me.
No, it does not.
Quentin, you know what? Quentin, I'm with all affection. It's Stephanie. You can wrap it up. I don't think Quentin is going to connect the dots here that we're trying to make. These are called analogies, and there's some dissimilarities with the moral point and some similarities. Stephanie's trying to construct a very simple argument about the difference between willing something bad and foreknowing and allowing something bad. Directly killing a baby versus knowing that a baby's death, which would be grieved and not intended, those two are not the same thing. Stephanie, just if you want to put a bow on it.
Sure. So to wrap it up, I think by his kind of reaction to resist the analogy, it shows that he was going to agree with me that no, he wouldn't be responsible for the death of that other person. But what if instead of Quentin grabbing only the one person, he held his other hand over the head of the second person and pushed that person's head underwater, thus drowning them? In both cases, that person would have drowned, but in only one of those cases would Quentin have been responsible for killing him. And so the same is true if a woman's life is in danger. We may not directly kill the child, but we may intervene to save the woman, and in trying to save her, as we're trying to grab two people who are drowning, we may not have the means to save the child as well.
Quentin in St. Louis, call back anytime. You're listening to Catholic Answers Live. It's 24 after the hour. Stephanie Gray is the Executive Director of the Canadian Centre for Bioethical Reform. The website is www.unmaskingchoice.ca, unmaskingchoice.ca. 1-888-31-TRUTH is the toll-free number. We only want to take calls from people who believe in the pro-choice rhetoric, so pro-lifers can enjoy the show. Everyone else, give us a call. With that, we go to Dallas to Billy on KATH. Hello, Billy. You're on the air.
Yeah, can you hear me?
Yep, go ahead, Billy. You're on the air.
Yes.
Oh, good evening. I'll make this quick. How do you respond, by the way, you do got a pro-choicer, how do you respond to the only way pro-choicers really have an argument here is if they just attack the whole idea of there really is a moral right and wrong. And how do you respond to a pro-choicer that says, well, I don't have to believe in God, I don't have to believe moral right and wrong exists, there's just correct and incorrect and survival, and only the fit will survive. So, in the wild, animals and insects kill their own young sometimes to continue their own survival. So there really is no moral right and wrong. It's just what society lets us do and don't do. How do you respond to a pro-choicer with that position?
Did you catch?
Sure,
it's
Billy.
a scratchy cell signal. Did you hear that, Stephanie?
I did, yes. So when people say that there's no right or wrong, you can respond with a question such as, are you right or wrong about that? Because making a definitive objective claim to claim that there is no objective truth is self-refuting. But the second point I would do is make an analogy and ask the individual if they saw a 5-year-old on a street corner and noticed a group of teenage thugs came over to the 5-year-old and started beating that child up. Would you not intervene? I would ask an abortion advocate. And if they would intervene and try to help that 5-year-old, then they recognize what those teenagers are doing is wrong.
And under strict Darwinism would say no need to intervene. But we got to go. We got a hard break. We'll come back and finish this tagline on Catholic Answers Live with Stephanie Gray. Be right back.
It's all about the truth. Catholic Answers Live.
Exorcism. Most of what the average Catholic knows about the practice is what popular culture has taught them through books, movies, or even plot lines in their favorite TV shows. They know it's part of their Catholic faith, but it's not really relevant to their lives. But evil exists. It's palpable. It moves about in the invisible world around us and is a very real and fearsome power in many people's lives even today. Ask Father Gary Thomas. He was a parish priest in California when he was called to Rome for training in the rite of exorcism, and his eyes were open to the darker side of the faith he had never known. Join Catholic Answers Live host Patrick Coffin as he gets all the facts in What You Need to Know About Exorcism, the Devil, Evil Spirits, and Spiritual Warfare, the riveting 7-part interview that's now available for the first time on audio from Catholic Answers. Phone 888-291-8000 or log on to Catholic.com to get your copy now. Father Thomas reveals not only the reality behind the rite of exorcism, but the reoccurring patterns of demonic activity in the life of every Christian. He tells you what you need to know, and more importantly, helps you to prepare yourself for spiritual battles you may encounter as you journey through life. Don't miss this groundbreaking audio presentation. Order your copy now at 888-291-8000 or our online store at Catholic.com. At Catholic Answers, we talk a lot about church history, the church fathers, the saints, and so on. These are men and women who wanted nothing more than to see the faith remain alive and strong for generations to come. We know you share that conviction, so we invite you to discover the Catholic Answers Legacy Society today. Simply log on to CatholicAnswersLegacy.com to learn more.
God loves us, and there's nothing we can do about it. This is Catholic Answers Live. I'm Patrick Coffin, your host. Our guest is Stephanie Gray. She's the co-founder and executive director of the Canadian Centre for Bioethical Reform. That website is unmaskingchoice.ca. This is a special edition of the show in which we do not want to hear from pro-life callers. The pro-lifers can certainly get a lot out of the show, as I am here as the host. We want to hear from people who are pro-abortion/pro-choice. And with that, I want to bring up one thing before we go to Chase in Bakersfield, and that is a story that's been dominating the news in the last few weeks, Stephanie, as I know you know, is the case in Ireland of Savita Halappavanar, beautiful young woman who died in a hospital. And it seems like a misinformation campaign has been put out there to cover the story. Now, you've done some last-minute research on this. What's the latest?
Yes, definitely. Well, I mean, actually, news has just come out today saying that it's possible now that she didn't even request a termination, which is what people were claiming had gone on, and she had been denied one. But as we covered just before the break there, when a woman's life is in danger, there's ways of addressing the medical condition without directly killing the child. But moreover, what people are overlooking in this situation with Savita Halappavanar is that she died not only of septicemia, which is blood poisoning, but also of E. coli ESBL, which is a very serious bacteria that can lead to septicemia. And E. coli ESBL is not the typical E. coli you get from food. It's a bacterial infection that can originate in the urinary tract. And what's interesting about that is that Savita first presented in the emergency room with lower back pain. And if someone has a kidney infection, one of the symptoms of that is lower back pain. And so it's possible that she had the E. coli ESBL already in her system, that it has made its way up her urinary tract into her kidneys. If it caused an infection, a kidney infection in a pregnant woman can lead to uterine contractions and therefore cervical change, which would then explain why she had a dilated cervix and why she was miscarrying. So even if they're claiming if the child had been taken out earlier, she wouldn't have died. But if the E. coli ESBL was in her urinary tract and in her kidneys, then the presence or absence of the child in her body would not have changed the presence of E. coli ESBL in her body, which is likely what ultimately led to the septicemia. So people are overlooking some important factors. Now, do we know for sure that it was in the urinary tract? No, we don't, but the autopsy is saying that this is one of the factors that contributed to her death. And so people are making this a case about abortion when it sounds to me like it's a case about a horrific situation that arose for a pregnant woman. And it sounds like in a country that has one of the lowest maternal mortality rates in the world, that they would have done the best to save this woman.
Yes, and unfortunately the toothpaste is out of the tube. The Irish Times reporter Kitty Holland only today, as you mentioned, admitting that the death of Savita may not have been related to Ireland's abortion laws. Of course, isn't it true, Stephanie, that the pro-abortion forces want to use this extreme case based on half-baked information to push their agenda on an entire country, namely Ireland?
Well, exactly. I mean, they're tragically taking advantage of a woman's devastating death and her family's devastating loss, taking advantage of that to try to have widespread access to abortion. And so that is what people should be outraged at, that they're, running with us.
All right, 888-31-TRUTH. Our guest is the co-founder and executive director of the Canadian Centre for Bioethical Reform. Stephanie Gray joins us from Vancouver, British Columbia. We go now closer to me, at any rate, Bakersfield, California, and Chase on 1050 AM. Hello, Chase. Welcome to the show.
Hi. Thanks for having me.
Chase.
I would first like to compliment you guys on just providing an open forum for people of differing viewpoints.
Thank you, Chase.
I think it's pretty important to be able to hear the other side, and you guys do so in such a calm manner.
Well, thank you, Chase. That makes our day. Thank you.
Yeah. Especially since I'm probably not your target audience as a pro-choice atheist.
Well, hey, Chase, if you have a radio, you're our target audience, and your worldview comes number two. Number one is that you've called, and we're glad you did. How can Stephanie help you? What's your question?
Okay. My question is, if the Catholic Church believes that abortion is the taking of a human life, then would it be fair to say that the women or the doctors who have or perform the abortion should be responsible or charged with murder or accessory to murder? And how does that work with cases of rape and
incest,
where the abortion might be able to save the woman's life?
Okay, we've got a little bit of sprawl there, but maybe the first part, fair question about being charged with murder or accessory to, Stephanie.
Sure. Great question, Chase. Would you agree with me that if someone, let's say, drowns their children in the bathtub, as has happened in the United States, that would be an act of homicide?
I would like you to not answer my question with a question, but go ahead. I'll go with you on that one.
Okay, that it would, and that there should be legal consequences for anyone who participates in that act of homicide, but understandably, when it goes before a judge or jury, they would look at things like the psychological state of the parent or whomever committed that act of homicide. Would you agree with that?
Okay. That's how law works. Sure.
Okay. So in the same way, if the preborn are as human as infants or toddlers who could be getting a bath, and we know scientifically, as Trent explained in the last hour, that they are, and if you need me to recap that, I will if you missed that. Therefore, consistency would compel me to say, absolutely, if someone commits homicide on the preborn, there should be legal consequences, as there are legal consequences if they commit homicide on the born. And as in each individual case, factors would be taken into account, like the psychological state of those involved, whether they were under any kind of pressure and so forth. That would be factored into what their legal consequences would be, but that at its core, we should have consistency. Otherwise, we're guilty of discriminating based on the age of the victim, that if your victim is young enough, then you have a lighter sentence. Do you think that would make sense?
Okay, but how does that apply toward instances of rape and where abortion could possibly save the mother?
Stephanie, has a direct abortion ever saved anyone's life?
Well, I would say no, because as we know, medically, you can intervene on the medical condition without committing a direct abortion, which is attacking the baby's
medical
body,
condition a person?
Body. No, the medical condition would be, let's say, an ectopic pregnancy, so an expanding fallopian tube, or maybe she has cancer in her body and she happens to be pregnant, and if it's required that she have chemotherapy at that moment because we cannot wait until the pregnancy progresses, then it's reasonable to administer chemotherapy, even if there's a risk to the child, because it's being administered to target a pathology within her body, which is cancer. So if the woman's life is in danger, we don't need to perform an abortion. Now, in the case of rape, let me ask you this. Would you say that abortion will unrape a rape victim?
No.
So if abortion won't undo what we both can agree is a trauma, then the question is, may we kill an innocent human because a guilty human, the father, committed a crime?
Oh, would the woman who has an abortion be guilty of a crime or accessory to the crime?
No,
well, if she lays her body down to have an abortion, she's permitting it to happen. But my point is, rape victims don't, if we know that abortion won't erase the trauma for rape victims, then it's our responsibility to not commit the abortion on a rape victim. So would you say that it's okay to kill someone because their father committed a crime?
No.
But isn't that analogous to abortion in the case of rape, Chase, is the question?
I'm saying that if somebody did have an abortion in a case of rape, would it be fair to tell the mother that she's an accessory to the murder of her child?
Well, again, that would be like the kind of the general sense I gave a few moments ago, where in the individual case, they would look at what was the psychological state, was she under pressure? Right? So assumedly, if someone has experienced a trauma, that trauma can therefore influence decisions they make in a negative way.
And reduce culpability.
And that would be looked at and reduce culpability. And so that would be looked at on a case-by-case basis. But she won't be having that abortion if the doctors around her don't do it. So your question also was, what about the physicians or nurses or medical professionals? Mm-hmm. Should they be charged with homicide, with committing homicide? Absolutely, particularly because they are perhaps not under the emotional stress that the pregnant woman can be, and as a result, they're acting with full knowledge of what they're doing because of their training. They don't have the emotional stress, and they're receiving financial compensation for it.
All right.
So
yeah.
would you say, Chase, that... Okay, go ahead.
Chase, one more time. Stephanie, I want to get one more caller in before the break. Chase, were you picking up what Stephanie was laying down? Did you catch the drift of her last question?
Yeah, and I would like to thank her for providing the answer she gave me. I'm just not sure how popular those answers are going to be.
Well, popularity always comes number 2 or 3 or number 50 when it comes to the truth and the preservation of human life and its dignity and its sacredness. We certainly, as followers of Jesus Christ, Chase, know that the fine print that comes with baptism doesn't really include popularity. We really want to focus on the truth and hopefully communicate it in love. But we're really delighted you're out there. Call back anytime. We do have Q&A open forums for atheists only. You'd be welcome to call back then or any other time on Catholic Answers Live. I was going to take one more caller before the break, but I'll wait. Rachel in Columbus, if you can hang on and just press your inner pause button, we'll come back and you'll be number 1 after our last break. One more segment with Stephanie Gray here on Catholic Answers Live. Q&A open forum for pro-choice folk only. If you believe that abortion is up to the woman's right to choose. If that rhetoric you buy into, we do want to hear from you. 1-888-31-TRUTH. I think you can tell from our guests, Trent Horn in the first hour, Stephanie Gray in the second hour. You will be certainly treated with affection and charity, although we may disagree diametrically. We want to be consistent in the dignity we express to everybody. So give us a call. 888-31-TRUTH. Rachel in Columbus, you're up next on Catholic Answers Live. Don't touch that dial. One moment later, we'll be back.
We'll be right back with more Catholic Answers Live. It seems our preparations for the celebration of Christmas often take a backseat to the busyness of daily life. While we can't set aside our obligations, perhaps we are allowing a little too much clutter to dominate our lives. As another Christmas draws near, your friends at Catholic Answers are once again hard at work to ensure that you keep your eyes fixed on the real reason for the season, the birth of our Lord Jesus Christ, and the faith He would later die for. When determining what to get the people you love, make your first stop Catholic.com. You'll find everything we sell, including subscriptions to our award-winning Catholic Answers magazine, reduced 10 to 25% and more through the end of the year. We've always encouraged you to give the gift of faith for Christmas, and during this year of faith, that takes on even greater meaning and importance. If you truly love those you're shopping for, be sure your gift selection includes things that will help them get to heaven. Save big today by beginning your Christmas shopping at the place you know and trust, Catholic.com. We've marked everything down as part of our annual Christmas sale. Log on soon to Catholic.com.
The Catholic Answers Minute. I'm Father Vincent Serpent. In Matthew 8:5, when Jesus responded to a centurion's request that he help his paralyzed servant, the centurion said that he was not worthy to have Jesus enter under his roof, but to simply say the word, and the man would be healed. I, too, am a man subject to authority, with men subject to me, he said, referring to the power he had over them. Jesus was most impressed with this Roman pagan who acknowledged Jesus' relationship to the Father and his supernatural power, to which the Jews were oblivious. Even today his words endure in our liturgy. Lord, I am not worthy to receive you, but only say the word and I shall be healed. It is a continual reminder that what matters most is the kind of humility and faith the centurion had, the love that Jesus has for us, and our willingness to make such humility and faith our own. I'm Father Vincent Serpa for Catholic Answers, Catholic.com.
Call now with your question, 888-318-7884. This is Catholic Answers Live.
We're back. We want to get to as many folk as we can to speak with Stephanie Gray, Executive Director and co-founder of the Canadian Centre for Bioethical Reform. She joins us from Vancouver, and Rachel joins us from Columbus, Ohio on St. Gabriel Radio, 820 in Columbus. Hey, Rachel, welcome.
Hi, guys. Thanks for taking my call.
Right on.
So let's see. Well, first off, I'd like to ask, have either of you been pregnant before?
I had a dream once, but then I went back on my medication. Kind of a personal question, Rachel.
Okay, well, I'm just saying, it seems like nobody who's called so far has been a woman, unless I missed somebody. But
I'm a woman.
That happens to be true.
No, I know you. Yeah, I know you are.
But Rachel, is the premise here seems to be unless you personally have been pregnant, you have no right to weigh in with an argument on behalf of.
No, I wouldn't say that. I'm just saying that helps give me more perspective about being pro-choice. I was initially pro-life, adamantly pro-life. Mm-hmm. You know, just like you guys, all your premises earlier, I used to hold those.
Okay, what changed, Rachel?
Well, basically, I became sexually active, but not until like 22. And that's when, and only with one partner, and I ended up marrying him. So,
okay.
But at the same, it just made me aware of how, you know, for a woman, you know, sex changes everything. It can change everything in her body. And,
Rachel, a lot of people listening right now, all over the world, who are hearing you right now, also became sexually active and got married, not necessarily in that order, and they remain pro-life. So what changed for you?
Sure. Yeah, well, I guess because at the time I was not married to my husband, and I thought, you know, what if we'd only been together for a few months, and I was like, what if he's not the one? What am I going to do? So anyways, but I don't want to dwell too much on that, but, you know, just knowing that was an option, even though I would never choose it, I don't think I would ever choose it, but my question, but one of my comments is basically is that you guys seem to be making an argument of false equivalence constantly. It's
okay,
basically saying,
Rachel, I want to get an answer for you. Let's hear it. What's the false equivalent?
Okay, yeah, the false equivalence being that a preborn human being is equivalent, has equivalent abilities to that's not born. I know you guys are saying it's a continuum and everything, and I understand what you're saying, but at the same time,
Rachel, go ahead, Stephanie.
Hold on. Just during the first 9 months,
Rachel, we never said that because it's a continuum, that means that preborn babies have the same capacities. They certainly don't. They eat differently and they breathe differently. We're talking about the moral status as having the inherent right to life. That we are saying. Stephanie.
Right. So if you would, for example, consider Rachel a infant in contrast to yourself, would you say that while you have different levels of functioning and current capacities, that both the infant and you have the right to life? Would you say that's correct?
I would say that's correct, yeah.
Okay. So then would you not also say that although the embryo or fetus has different current capacities and functional abilities in contrast to the infant or you, that by virtue of it having human parents and it being human offspring, it has the same right to life as the infant or you?
No, not necessarily.
Okay, why not?
Because it is completely dependent on the mother's biological functions. There's a difference between an infant being, dependent on, parents to have to care for it, but the parents could at that point be anybody. But if the mother, chooses for one reason or another that she wants to have an abortion, she's still the only person that carries that child. And having been pregnant and having had some complications, I can say that it's very distressing, and you can't always just tell somebody to give it up for adoption.
It certainly can be very difficult for some people, and I don't want to minimize the crisis that a challenging pregnancy can be for some people. But let's kind of imagine a scenario where you have a couple that have a child at home, and no one knows that they were pregnant, and after delivering the child at home, they leave the child on the couch, and they walk out of the house, and they don't return for 2 weeks. Do you think that they should be charged with homicide?
Yes, I do. Well, manslaughter, I guess it is.
So, Rachel, do you see? Go ahead, Stephanie.
What it seems that you recognize there is that child, no one else in the world knew to care for it, so therefore they didn't care for it. The only people that knew to care for it were the parents. They neglected in doing that, and you would consider what they did to be wrong. So why wouldn't you also consider what they could have done to that child just a little bit earlier if it was in utero to be wrong?
Well, because that child has the potential of being put up for adoption, given foster parents or anything. An embryo or an early fetus does not have that potential.
Rachel, they surely do.
And why doesn't it?
Yeah.
Why doesn't it have the ability to be given up for adoption right away? An embryo.
Because it's biologically tied to the mother. The mother provides all it.
And why is it biologically tied to the mother?
Because it's from her egg that implanted into her uterine wall, and I'm not sure exactly where you're getting with this.
I guess what I'm trying to get at is the reason that particular child needs to actually be in the mother's body and totally dependent on the mother's body is because in our species, when we're that age, that's our degree of dependency. That's our required location for growth and development. In the same way that newborn infant I asked you to imagine, because of its age and vulnerability, needs someone to care for it in a way you wouldn't if two adults walked out of your home, leaving you in a house by yourself. You could care for yourself, unlike the infant. So if you deprive the preborn of their right to life because of their dependency on their mother, since their dependency is inherently associated to their age, you're discriminating based on age.
Rachel.
Do you want to discriminate based on age?
No, because it's not. I do understand what you're saying. I get where you're getting at, but I think that is still a very huge. You're making it seem like it's a minor difference. It's a major difference. An infant at least can still breathe and eat. In a sense, on its own once it's being fed, it can breathe on its own.
But it requires other adults' bodies.
Yeah, within hours, the child will die within hours, Rachel, without food.
Sure. Yeah. No, I understand. I had a baby.
Mm-hmm.
But what I'm saying is that at that point, anybody can take care of that baby. If the mother is not mentally well enough or is not physically capable of taking care of that baby, and at some other point or another, then that baby can be handed off to somebody else when it's in her body and characterizing
it. It sounds to me, Rachel, that you're saying because the embryo, if I'm hearing you right, because the embryo is so totally dependent on her, that permits her to have an abortion. Is that a correct summary?
Yes.
Yes? Okay. So now let's consider for a moment, if you have a 2-year-old who demands from you food. Okay, perfect. You have your 2-year-old, demands breakfast, lunch, dinner, day after day after day, and you don't feed your child. Will you be charged with neglect?
Services come. Then, yes.
Right.
Then
okay.
Children's services come. Take her out of my care.
Well,
Okay,
actually,
imagine.
the coroner will come first, Rachel, if the child doesn't survive your abuse, right?
Well, yeah, that's also depending on whether or not people would also see patterns of abuse and everything.
Well, sometimes not, but that's separate. Stephanie, go. By the way, I want to get, I want to get to one more call, but maybe you can put a bow on this one, Stephanie. We can move on.
So to kind of move it forward, if that 2-year-old is now a 22-year-old college student returning home for the weekend and demands breakfast, lunch, and dinner from you day after day, and you say no to your child, you're not going to be charged with neglect. What's the difference between your child as a 2-year-old and your child as a college student? Dependency. Our society recognizes by virtue of the 2-year-old being more dependent than the college student, you have a heightened responsibility, not a lessened responsibility.
Right.
So when you hone in on the dependency of the preborn child, what you're actually unwittingly doing, Rachel, is you're making a really good case against abortion, because the fact that you identify that the preborn is so totally dependent on the mother makes her more responsible, not less.
Rachel, thanks for the call. I want to get to one more caller. Casey in Seattle, Washington. You're on the air. Go ahead.
Hi, thank you. I just wanted to say really quick that it's really great to listen to this discussion because it's been very respectful, even though there's different views. So that's very cool.
Thank you, Casey. Appreciate it.
No problem. I just was calling because the part I don't get is that how you and your religion should change a law.
Okay, so why should one's beliefs dictate law for everyone else, Casey? That's the question?
Mm-hmm.
Great. Stephanie.
Okay, good question. I would say, Casey, that my religion tells me that rape is wrong. And I believe that rape should be against the law. Do you agree with me?
Yes.
Okay, so here's an example of how a religion can claim a view, as well as non-religious people can hold that view. And what we recognize is that independent of a religion weighing in on it, we recognize the act of rape violates another human's basic rights. And as a result, we need a law. So the question is abortion killing an innocent human being?
Well, I guess then because I don't believe that birth starts at conception.
No, Casey. I think you mean life, not birth.
I mean
right?
life. Yeah. Sorry. Yeah, okay. That's exactly.
So
what
when would you say life begins?
I meant that.
Casey, when does life begin, Casey?
I don't know. In the Bible, it says that you're alive when God breathes breath into your lungs.
Well, it actually doesn't.
Let's set aside.
Yeah, Casey, we covered this a little bit in our first hour. If you wanted to check out the podcast with Trent Horn. It's true or false, Stephanie?
Sorry, I tuned in later.
That's okay. But Casey,
no worries.
Yeah, but the Bible is in our scientific textbook, right, Stephanie? I mean, this is you haven't mentioned religion once so far.
Yeah, and so some people, Casey, might want to talk about the book of Genesis, but we could even start by looking at the law of biogenesis. So moving from religion to moving to science, and the law of biogenesis says living things come from other living things. So we know that the preborn, by virtue of that basic scientific principle, have to be alive. And we also know scientifically that living things reproduce after their own kind. So dogs are only going to produce dogs, and humans are only going to produce humans. So when would you say science says life begins? Not the Bible, but science.
Megan, we'll have to keep it a rhetorical question. We're at the end of our show. Not Megan, excuse me, Casey. It sounds like you just stumbled onto the show, Casey. We're glad you did. Tomorrow, 22 hours from now, we're going to have a Q&A open forum for everybody, and please call back then if you wanted to follow up. Megan, Linda, and Barbara, we're sorry we didn't get to you. Boy, not sorry we had you on the show, though, Stephanie Gray. Thanks for joining us.
Thanks, Patrick.
Enjoy Canada. You're making me homesick. All right, we'll talk to you soon.
Merry
God
Christmas.
bless. Merry Christmas to you. All right, 22 hours from now, I should say, Tim Staples and Patrick Madrid Q&A open forum Friday. That's right, this Friday. Country music superstar Colin Ray will be in studio on how to be Catholic in public. Big show on Friday. Don't miss it. This is Catholic Answers Live. Be a saint. What else is there?